Do you ever feel like you're not quite yourself? Maybe you find clothes in your closet you don't remember buying, or someone says you acted totally different yesterday. Imagine having different yous inside your mind, each with their own voice, memories, and feelings. That's a bit like what dissociative identity disorder, DID, feels like. It's not about acting like different people on purpose. It's more like parts of your mind split off to protect you from pain, usually from very hard experiences long ago. It's rare, but real, and people with DID often don't even know it's happening at first. Why does DID happen? Think of your mind like a video game character. When the game gets too hard, instead of crashing, the character sometimes splits into different modes, like quiet mode or fight mode, to survive. That's what the brain does with DID. The main cause, usually it's severe abuse or trauma in childhood, like physical, emotional, or sexual harm, especially before age 6 to 8, when the brain's sense of self is still forming. The child's mind dissociates, meaning it mentally checks out, as a way to escape the pain. Over time, these escapes turn into separate parts or identities that can take control at different times. So how do you know if someone has DID? Let's play a quick game. Have you ever driven somewhere and suddenly woke up with no memory of the trip? That's mild dissociation. But with DID, it's more extreme. A person might be talking cheerfully, then suddenly switch. Voice lowers, body posture changes, and they say, "Who are you? I don't know this person." They could find notes they don't remember writing, spend money they don't recall using, or hear voices inside their head. Other signs: huge memory gaps, like forgetting whole years, confusion about identity, and feeling detached from your body, like you're watching yourself in a movie. DID is hard to diagnose because it looks like other problems, such as schizophrenia or bipolar disorder. But here's the difference: DID isn't about hallucinations, it's about lost time and identity shifts. A skilled therapist might use interviews and special tests, like the Dissociative Experiences Scale, to check for it. Treatment isn't about getting rid of the parts, they're protectors. Instead, therapy, especially trauma-focused psychotherapy, helps the parts talk, work together, and slowly heal. Medication can't cure DID, but it can help with anxiety or depression. Over time, many people learn to live fully, with fewer switches and better memory. Can DID be prevented? Not easily, but we can reduce the chances. Think of it like a tree. If it grows in stormy, rocky soil, it may twist as it grows. But if we protect the soil, meaning stop abuse and neglect in childhood, the mind grows strong and whole. That means safe homes, caring parents, and support for kids in trouble. Early therapy after trauma can also stop dissociation from becoming a long-term pattern. So prevention isn't about fixing DID directly. It's about protecting kids and helping them feel safe when they're young. Recent research is changing how we see DID. For years, some believed it wasn't real, just made up. But brain scans now show real differences. When different identities are active, blood flow and brain activity actually shift in measurable ways. Some studies use fMRI to show that switches aren't pretend, they're physical. Also, new therapies like EMDR, eye movement desensitization, and reprocessing are being adapted safely for DID to help process trauma without overwhelming the person. There's also growing hope through integration, not forcing parts to merge, but helping them cooperate so the person feels more in control and at peace.